Welcome one and all. This is Dr. Veeraja Rao, and I'm assistant professor in psychology. And for the past 18 years, I've been into teaching, and I'm a counseling psychologist as well. And I feel honored to be part of this international seminar on social work and social services. So today I would be sharing about health and well-being, which is very essential for the mankind. So let me share the screen now. One second. Yes, I hope you are able to see the screen now. So this is about health and well-being. So the state of health can be understood as a positive state of well-being here, which is not simply the absence of injury or disease. In fact, it's physical, mental, and social well-being. So it varies along a continuum with one end as optimal wellness. And the other end as illness or premature death, whereas in the middle would be the average health or neutral point. So when we try to understand well-being, there's a connection between or a relation between mind and body. And well-being state is a state of happiness, contentment, peace, with low levels of distress and overall maintaining good physical and mental health and maintaining good quality of life as well. So it's a dynamic concept. In fact, subjective well-being means when a person cognitively and emotionally, evaluates his or her life, they still feel, okay or good about their life, and that's what is known as subjective well-being. And there is social well-being and psychological well-being, which consists of dimensions like self-acceptance, autonomy, environmental mastery, maintaining positive relatedness with one's own self as well as others here. So, and here we need to discuss about the concept of mental health also, because it's a state characterized by emotional well-being and maintaining good behavioral adjustment, relative freedom, and a capacity to establish good constructive relationships and ability to or having or maintaining coping resources to maintain stress in life. And here, as I already stated, about the continuum, there would be a state of increasing wellness from neutral, and there is a decrease into, towards illness or premature death. So there are various states or stages in this. For example, if let me show this continuum. Yes, here one moving towards awareness, say from the neutral point to the awareness, maybe the person has already achieved that wellness approach or mastered, I would say, that wellness approach, but still they need some training to go to the next stage here. So when they are trained about how to master the wellness, and they will be creatively, they generally gain a creative ability to handle the stressors or like critical events and circumstances in life. So growth is possible, but once that reaching optimal wellness means almost a kind of actualized state. It's very difficult though. But when it comes to the moving towards premature death or illness or destructive symptom stage, that means a person is into some severe problems. It could be stress, it could be due to anxiety, it could be due to frustration, or it could be due to some biological problems as well, physical problems, psychological problems, or social factors. But here actually we need to understand health from biopsychosocial perspective. That means health can be influenced by biological factors, psychological factors, social factors, and that generally determines health and wellness, both at the macro level as well as the micro level. Micro means here, cellular and genetic disorders. So the psychological factors, social factors, biological factors, that means, genetic factors, some predispositions, all these leading to physical problems, and psychological problems, some experiences, childhood experiences, traits, distortions, personality, and then social factors like socio-economic status, educational status, and then marital status. So all these could be having, tremendous influence on health. So here we need to understand, health holistically. That means, if you want to understand health, first of all, the social systems are to be understood, the society, community, family, because each and every aspect will have its influence on one's own health. So individual to be understood from all these aspects, like, psychological systems, the cognitive, emotional, motivational aspects, so biological systems, again, tissues, cells, to that, micro level we need to understand. So here, a team of good, professionals are very, very important to understand healthier. So which particular state a person is in, for example, reactive state with, fatigue, insomnia, irritability, other than, physiological aspects here. And then, positive and negative emotions, the intensity and the frequency of all these emotions, and stress controlling one's immunity, and the anxiety, again, influencing their blood pressure, diabetes, arthritis, heart problems. In fact, stress, controlling the immunity, and that leading to, again, cancer. Yes, we did, hear many such cases as well. And then, frustrations for longer periods, it leads to distress and depression. And here, what it could be a problem, related to COVID-19, or it could be, problem related to any unpredictable problem as such, due to stress, anxiety, frustration, and many other problems. First of all, we need to assess the problem empirically with these team of, professionals, family members, and the person, him or herself. First of all, they need to identify the problem, acknowledge the problem, accept the problem, and must go for the treatment and improvement, including, psychological treatments. Anyway, medication is very, very important at various levels here. So what next here? So after all, world is in a state of progress, though, now temporarily we are into a kind of, confusion, but human and social problems, they must be conceptualized in environmental terms that is highly marked by optimism. So for lessening them, and of course, improving individual as well as, community life, which is very, very important here. So let us come up with certain, kind of preventive equations. So what are the, preventive equations here? I would like to, share with you here, very interesting, prevention equations. At individual level, first of all, we need to reduce, stress, of course, and the physical, vulnerability as well. And here, coping skills or coping resources are to be, improved, of course. And then, increase the perceived social support. So perception is very, very important. First of all, sometimes we may not be in that stress situation, but how we perceive the situation as, with, or, a person who thinks that he or she has certain, like coping resources, might not take that particular, situation as a stressful situation. That's why, it varies from person to person. And then, maintaining good self-esteem. So these are the prevention equations at individual level. When it comes to environmental level, first of all, reducing the stressors are very, very important here. And eliminating the stressors in key socialization, events here. And other than that, reducing the risk factors here in the environment that results in increased physical, biological, vulnerability will be decreased here. And then increasing the accessible, social support resources, and increasing the opportunities for positive relatedness to others, and connectedness to positive social institution, and positive social groups, and positive, social work groups here, agencies, and other formal and informal settings, like, your social work groups and organizations are very important. This is at environment level. And friends, we all know these prevention equations at individual level and environmental level. It is not possible just with one particular discipline, but we all must work together, whether it comes to science or psychology or sociology or social work. It's all kind of, interdisciplinarily, we must come together and work for the benefit of the mankind. And this is very simple, but as I already stated, it is very, very essential. And thank you very much for giving me this platform to share my views on this aspect. So thank you very much.